Hi, my name is Elizabeth. I'm a travel woman from North Dublin, and I just want to give you some information about travel women's mental health during and after pregnancy. So we decided to go and ask some midwives at the Rotunda about travel women's mental health in general. We picked a few questions that we think, personally I would think, and other travel women might think, these questions that we'd want answered. Some travel women are concerned and be worried about their children being taken away and not wanting to come forward about their own mental health, and they shouldn't have to suffer. No one should have to suffer. Some women do suffer, some women don't, and it's just potluck which ones suffer and which don't. And so we just want to inform the women that are suffering that they can come forward and have a chat with the women at the Rotunda, and they don't need to be fearful of that. And here are the questions that you get answers from, and if you need any more information you can contact the Rotunda or Exchange House. Thank you.
My name is Bridget McCarthy and we're here to talk about women's mental health. What is prenatal mental health?
Hi, my name is Jean. I'm one of the mental health midwives here in the Rotunda Hospital, and I'm here to answer a few of your questions in relation to perinatal mental health. So what is perinatal mental health? The term perinatal refers to the time from when a woman becomes pregnant up to 1 year after the birth of the baby. So perinatal mental health refers to the mental health of women during their pregnancy and the first 12 months after the birth.
Hi, my name is Elaine Collins and I'm a traveller from the Meath area. And I want to know, will Tusla be informed if I tell the nurse about my depression?
No. Suffering with depression is absolutely not a reason for referral to Tusla. Talking to us is your choice. Our role is to try and help women recover from their depression. Depression and anxiety are very common in pregnancy and after the birth, and we know that almost 1 in 5 women will have problems with their mental health during this time. Out of the almost 9,000 deliveries in the Rotunda in 2019, over 2,000 women were seen by our team. Unfortunately, we do have to make referrals to Tusla in a very small number of cases if there are concerns that a child is at risk of harm. However, this applies to all women that attend both the hospital and our service, and all healthcare providers are obliged to do so under the Children's First Act in 2015. Having depression, however, does not warrant a referral to Tusla.
Will my children be taken off me if I open up about my mental health issues?
No, suffering with mental health issues and mental illness does not mean you are unable to care for your children. Unfortunately, there is still a lot of fear in talking about your mental health for this very reason. Our role is to help women and their families on their journey of recovery through support, talking therapies, and sometimes through medication also.
Does having a mental health difficulty make me a bad mother?
Absolutely not. This is a very common worry amongst mums experiencing difficulties with their mental health, and it's frequently the reason that women don't ask for help, as they're afraid that this is how they will be viewed. Asking for help is not easy, but please do ask. It is the first step in your journey to recovery. We're here to help you, not to judge you.
Will other traveller people find out that I have mental health issues if I open up to prenatal services?
No, we absolutely won't be disclosing or sharing any information that you share with us outside of our service. However, you may choose to share with your family or friends.
What if I don't want people visiting my home for privacy reasons?
Hi, my name is Leanne O'Neill. I'm a clinical nurse specialist in the perinatal mental health team in the Rotunda. Home visits are offered to women on an individual basis and are always carried out with the woman's permission. For some women, it may be easier to be visited at home by the nurse rather than trying to get into the hospital for an appointment.
Hello, my name is Mary McDonough. I am from Exchange House, Ireland. How can I attend appointments if I have no one to mind my children?
Usually mothers can attend appointments with their children and babies. However, because of the restrictions imposed due to the COVID-19 pandemic, this has not been possible over the last few months. We hope this will change as restrictions are lifted, We can offer phone consults to women where we will call them and carry out the session over the phone. We will try to work appointments around your schedule.
Hi, my name is April Ward and I'm a traveller woman from the Blanchardstown area. My question is, what does mental health services look like?
Each service will look different depending on the hospital. Usually you will meet with someone from your mental health team in a private area or office. Some units may have an outdoor space for you to talk, for example in a garden. When a woman meets with someone from the mental health care team, the meeting involves having a conversation and talking about thoughts, feelings and concerns. During the visit, the woman may be asked questions about her past, her family or what's happening for her. We want to explore how we can best help and support you. For some women, they may only attend our service once. For others, they may need more regular support throughout the pregnancy and after the baby is born.
Hi, my name is Elizabeth. I'm a travelling woman from North Dublin and I'm just inquiring how long can I access the perinatal mental health services for? Thank you.
Perinatal mental health services can provide care for women from the beginning of their pregnancy all the way up to 1 year postnatally, depending on each woman's individual needs.
And when I come home after being discharged, if I start to struggle again, is there an aftercare person that I can contact to help me?
Women are discharged from our service 1 year after the birth of their baby. Some may continue to attend a community mental health service, others may be referred to their GP. This can be discussed between the woman and their mental health support worker to make a decision together.